Hi, this is Allie Bolgart, and today I'll be sharing an empirical article on the outcomes in young adulthood. The article explores the experience of individuals with an intellectual disability and if we are achieving community participation and inclusion in their daily experience. This study is an 18-year-long longitudinal study to understand the changes and effects of different living arrangements, participation in daytime activities, and social involvement in a community of young adults with ID or intellectual disabilities. The location of the study is New Wales and Victoria, Australia, and started in 1991 with completion in 2010. The study identified the importance of this research as a longitudinal study to truly identify the changes as individuals with ID transition from childhood to adulthood and how childhood conditions may affect young adulthood experiences. Another unique aspect of this study is that it also studies the needs of the caretakers of these individuals and how we can better support an inclusive and healthy lifestyle for both individuals with ID and their caretakers. The literature review conducted prior and during the study revealed three key areas of focus which informed this research and the methodologies used. The research identified that the family home is the predominant place of residence for young adults with ID, and that they are 3 to 4 times less likely to be employed, and that they tend to interact only within the ID community and have fewer interactions within the wider community. Overall, we can already start to see that we are not achieving inclusion and community participation for individuals with ID. The participants in this study are the caregivers and parents of each ID individual. These are actually the people who reported data throughout the longitudinal study about their ID children and their own individual health. And if the young adult with ID lived at home at the end of the study, the parent provided data about their satisfaction with long-term care. The other participants were the intellectually disabled individuals themselves who participated in 5 waves of research over 18 years. Participants were identified from the Australian Child to Adult Development Study of a very large population of children, and they identified in Wave 1, which started in 1991, 536 participants with ID to participate. These participants were aged 4 to 18 at the beginning of the study. And at the end of the study in Wave 5, there were 354 young adults still participating, and their age ranged from 20 to 37. The methods used for each group of participants provided demographic data and data on the 3 big areas of focus: living arrangements, daytime activities, and social community involvement. The parents were asked to complete a general health questionnaire at each wave of data collection, and at Wave 5, again, if their child lived at home, they were asked to complete a survey on their satisfaction with the long-term care plan of their child. The ID participants' data was provided by their caregiver or parent in the following areas. The first was the degree of ID, which was identified as mild, moderate, severe, or profound, and this was based on a diagnostic and statistical manual of mental disorders. The second was based on a developmental behavior checklist, which was the DBCA, which measures behavior and emotional problems in young people with ID. The third was around community inclusion, identifying what their living arrangements are, and also their daytime activities, which could include day programs, paid employment, or school or learning activities. The next was the Index of Social Competence, which measured competency across communication skills, self-care skills, and community skills. A higher score in this meant that there was less social competence in that individual. And finally, the Community Social Involvement Survey, which assessed activities that they were involved with, and these could range from recreational activities, attending events, or attending community spaces like libraries, museums, and parks. And the higher the score in this area, the greater involvement they had. The key findings were around the 3 big themes in the study and showed the gap for inclusion and community participation for individuals with ID. We saw an increase in individuals living in home over the longitudinal study and a relation between living in home and a behavior and emotional problems, which was higher than those for living alone or in a group setting. The study reported minimal daytime activities for about a third of the cohort and showed that a majority of participants only interacted with other ID individuals, which was linked to more behavioral and emotional problems than if they participated in mainstream community activities. The study also identified that individuals with more severe ID typically related to social exclusion and lower social competence. In tandem, from the parent and caregiver perspective, 25% of caretakers reported fair to poor health over the course of the study, indicated higher than average mental problems, and about a third reported being dissatisfied with their long-term care plan for their child. So, what does this all mean for the current experience of individuals living with an intellectual disability and their caretakers? For living arrangements, it seems there could be inadequate residential spaces based on the quantity and quality of service offerings, and perhaps they don't meet the standards of the caregivers and parents. It also shows that there is a need for improved employment opportunities for these individuals that provide both community experiences and a daytime activity, or more daytime activity options that promote social inclusion and community participation to provide a better experience, not only for these individuals with ID, but also for their caretakers as it gets them out of the house and communicating with others and perhaps even improved emotional and behavioral states. So, when thinking about equity for these individuals, which would be both the people with an intellectual disability and these caretakers, I've been thinking about the policies or programs that could be put in place to better support their experiences for inclusion and community involvement. I've written some ideas down here, so feel free to pause the recording and take a read, and I look forward to hearing your ideas in class. Thank you, and see you in class on Thursday.